hormonal imbalance. The first thing is one is specific. Of prolactin. I told you that. Dr. Dara is saying, hi doctor, how many children can someone have without cesarean section? Now, medically it is advisable to have at most 3. The maximum should be 3. So if you've had 3 births after cesarean section, that is the maximum which is medically advised. However, we've seen women going up to 4 and 5. So what would be my advice? My advice would be, if you are really spending, after cesarean section, if you are able to spend at least 2 years without conceiving, in other words, conceiving after 2 years or every after, then on the 3rd pregnancy, after the 3rd cesarean section, if you can spend a period of 3 to 4 years, then you can have another child. And also the same applies to the 5th, if you can spend at least 3 to 4 years. So the medical advice is 3 years, is 3 children, all 3 deliveries after cesarean section. However, there are circumstances. Most women will have different, they have a lot of different, they have variations, they have psychosocial issues. Someone will tell you, I had these children and they all died, now I want to have the 4th one. So at times those circumstances come in and you advise them to have more, okay? But it shouldn't again go beyond the 4, okay? And what we say is that if you're to have another child after cesarean section, after the 3 scissors, then it should be, the period should be between, it should be above 2 years, 3 years and above. That is what I would tell you. I don't know if I've really answered you clearly. That failed. What are you saying? Okay. Let me continue with TikTok, then first fix complete YouTube and let me know. So should I continue? First finish. Okay, we can continue. Okay. All right, I think we are welcoming back our YouTubers. They had gotten off. They had an issue with their audio. So I think the audio is now fixed. Thank you so much, and welcome back those of you on YouTube. So let's continue with our questions. I was saying that You can spend with a cesarean section after cesarean birth. Medically, it's supposed to be 3 scissors. But if you can add more, then you should spend 3 years after the birth. All right. So we have another question here. Namatov Aisha is saying, Doctor, I'm Aisha. I have blocked tubes. What should I do? Now, for those of you with blocked tubes, there are medicines for blocked tubes. Okay? So what you can do, what you can do with blocked tubes, we have several methods of unblocking tubes. The first one is tubal flushing. There is a method called tubal flushing. It can be done to unblock the tubes, though it is a little bit weak. Now, the next method there we can use is tubal canalization or recanalization. That one can also be used. Okay? With tubal recanalization, what we do is we get a cervical cannula. Okay? We get a cannula, very, very small, and it is pushed into your fallopian tubes. Okay? Let me demonstrate it for you. Let me demonstrate it for you. If we have let me demonstrate it for you. I think everyone understands what I'm drawing here. So if you look at this, this is our womb or the uterus, bracket the womb. I think this is the place you people enjoy most. This one is the V. You people enjoy this place so much. I know you know it. So then we have the cervix, okay? And then this is the main issue we are talking about, the fallopian tubes. Fallopian tubes. Now, if the fallopian tube is blocked, okay? For example, the fallopian tube is blocked from here. What we mean by recanalization, how to open that fallopian tube, is that you will get something like this, like a cannula like this, okay? And you will fix it here. I don't know if you're seeing. You will fix it here, then it will come to at the fundus, then you will turn it, enter here. When you reach here, the area of blockade, you will start. You hit this area of blockade with some little pressure, okay? So when you hit this area of blockade with some little pressure, you erase or you displace the blockade. So after doing this, this tube will be open. And when the tube is open, someone can be able to conceive. Because we said that for fertilization to occur, we are supposed to have, someone is supposed to have sex, unprotected sexual intercourse. Sperms will be deposited here. Okay? They will swim. Sperms will swim. And remember, for a woman, they will have produced an egg, which will be found here. So when the egg is found here, when the egg is here, these sperms will swim and fertilize this egg. But now, if the tubes are blocked, the sperms will not have anywhere to pass. They will be blocked. Even the egg will be blocked. Therefore, fertilization will not occur. So if we unblock those tubes, then someone can be able to conceive. Therefore, that method can be used. Okay, and another method which can be used, to unblock the tubes is the laparoscopy. Okay, we can use laparoscopy. We can use laparoscopy to unblock those fallopian tubes. So there are several methods that can be used to unblock your fallopian tubes. Okay, then another one is saying, I think I've answered you about the blocked tube and blocking tubes. How serious is angina? Bora is saying, how serious is angina? I said that I will be answering questions regarding reproductive health. I'm sorry, this is a question which is regarding a cardiovascular system. So you need a heart specialist or a cardiologist, a cardiac surgeon, and so on to answer such questions. Yes, I know something, but I am not so good in that area, so I will not be able to give a bright answer. My questions, I always want to answer things concerning reproductive health. Okay. Mrs. Magembe is saying, ovulation tests, but are there ovulation tests I can use to see when my ovulation is? Yes, there are ovulation test kits. They are already on market. There are those that use that contain yes, they are there. Just go there and buy. If you go to the pharmacy, ask for an ovulation test kit. It is there. You can test and get yourself results. Bibi Yusuf, hello, how are you and where are you calling from?
Hi, Dr. Uthman, how are you doing?
I'm okay. Increase your sound, be very loud. We want everyone to hear, especially those.
I am in northeastern part of Kenya. I'm in specifically Garissa, and I've been watching your lives, and I've been interested to discuss some issues with you. Can you hear me properly?
Yes, I can get you clearly. Be very fast.
Okay. Thank you. And I have fertility problems, and I've been married for almost a year right now. My husband has not been around. I went to Nairobi and I met a gynecologist, and I had several tests, and I was diagnosed with PCOS and insulin resistance, and I've been given some medications, but and they weren't effective. What do you call this? I have regular periods, 28 days. I don't have irregular periods. My periods are regular. So I kindly wanted to know what is the problem with me.
All right, of course, the problem is very clear. They told you have polycystic ovarian syndrome, PCOS. So until we treat this PCOS, things won't be fine. Okay? So you need a clear treatment for PCOS or for polycystic ovarian syndrome. I don't know which medicine you've been taking. Which medicine are you taking for polycystic ovarian syndrome?
I was given myoatom.
Okay.
And myoatom and another one which is mostly for diabetics.
Yes.
Can I share the name with you?
You tell me the name. Okay, as if we are losing her. Engineer Kadonya Selector. Hi, Doctor. Hi, how are you? Dr. Dara, thanks, all right. Okay, all these ones are just thanking me. Doctor, another question is it possible for a person to push after 2 previous cesarean sections? No. There is what they call VBAC, vaginal birth after cesarean section. But this chance is given to someone who has had 1 cesarean section. Okay? Dr. Dara, you only advise someone to push after cesarean section when it is 1 cesarean section. But when it goes beyond 1, 2 cesarean sections, 3 cesarean sections, you are not advised to push. I would repeat, there is what they call VBAC, vaginal birth after cesarean section. Most women will have a cesarean section when their problems can be solved later on, okay? For example, a woman had a cesarean section because the baby got weak. Someone will tell you that your baby has weakened, there is distress, so let's do a cesarean section. In the next, if you spend at least 2 years without conceiving and conceive later on, that next pregnancy can be given birth normally. You can deliver normally. Okay? So because the problem we don't think the same problem will occur, except if the problem or the reason as to why a cesarean section was performed was an inadequate pelvis. For an inadequate pelvis, that problem will not go away, because this is regarding your anatomy. The human anatomy cannot change, especially if you are born with a small curvature in your pelvic cavity. If you are born with ischial spines in your pelvic cavity, those ones will not change. And therefore, if you've had a cesarean section, that means all your babies will be delivered under cesarean section. It can only, you can deliver vaginally if the reason as to why you had a cesarean section probably was, number one, a big baby. It may be this time around you not have a big baby. The baby will be of a normal size. If the problem then was distress, we've talked about many problems, you can deliver again. But if you've had 2 cesarean sections, even if the problem is big babies or fetal distress, the baby is tired, if you've had 2 cesarean sections, you are not allowed to have a normal delivery. I think that is also very clear with you guys. Yes, Bibi Yusuf, be very fast. Be very fast. We want to move on. The mic is off again.
Hello?
Yes, be very fast. Go on with your question.
Hyponid. It is called hyponid. The drug is called hyponid with myoatom. Those are the 2 drugs that I was given.
Okay. All right. So now, what I would advise you... Yes?
Can I ask you? I have 2 questions.
Yes.
My periods are normal. But the problem is, I think I don't ovulate. That is the problem I'm having. And the other thing is, what can I do to conceive? How can you help me? What should I take? There are some doctors who advise me to take metformin with clomid. Others advise me.
Let's leave it at that. Let's leave it at that. Let's go to the main treatment. Now, what you are supposed to do is, first of all, to run a full fertility hormonal profile. With that full fertility hormonal profile, you need to know the levels of your progesterone, you need to know the levels of your prolactin, you need to know the levels of your estradiol, you need to know the levels of your luteinizing hormone, follicle-stimulating hormone, and AMH, plus some other tests, but those ones are a must. Hold on. So when you have those ones, you will also need to do what they call a random blood sugar. Because if you're to take clomiphene, then we must know your blood sugar levels and cholesterol levels. Okay? Because some people we give them, some people we give them, you are talking about an anti-diabetic drug, which is, you're talking about you've talked about a hypoglycemic, isn't it? You are given some anti-diabetic drug.
Yeah, anti-diabetic drug, yeah.
Metformin. Yes, so before you take...
I was not given metformin.
What were you given?
Given an hyponodid.
All right, whatever you were given, but we are supposed to take an... Hold on. You see, we are taking a lot of time. I want to crown this out, okay? So what we are supposed to do is to run those tests. When you have those test results, you can now be given medicines tailored towards the results, okay? First of all, you may receive hypoglycemics depending on the levels of your sugars. Number 2, you will need drugs that treat directly polycystic ovarian syndrome, or PCOS. Those drugs must contain an ingredient called inositol. Drugs like Rimona, drugs like PCOS, etc. They contain that drug, and many other drugs that contain inositol. As long as they contain inositol, you can take them. Now, when you realize, of course, we talked about the fertility hormonal assay, but we also have done a pelvic ultrasound scan to assess the magnitude of the problem of the PCOS. Okay? So now, when we have all those results, you can take the anti-PCOS drugs, the ones I've talked about. You can take the hypoglycemics, the metformins and glyclamines of this world. Then later on, also depending on the fertility hormonal assay results you have, we are looking at your luteinizing hormone, because you're stipulating that you have a problem with your ovulation, but we are not sure because we don't know the levels of your luteinizing hormone. Sometimes if the luteinizing hormone levels are low, then you will also be given medicines to stimulate overproduction or to cause hyperstimulation of the ovary. Those medicines, you need them, and those medicines include the likes of clomiphene, what you call Clomid. It includes the likes of Letrozole. It includes the likes of tamoxifen, the likes of medicines, injections like Menapa. All those medicines can be given. Now, I cannot give you a specific drug that this is the drug you're going to take, but there are several drugs we can use depending on your results. I have always said, I've always told you people, my followers, that I do what they call evidence-based medicine. Not just saying I have polycystic ovarian syndrome and I tell you, take this medicine. What have you done these tests? What do we know about your body? We need a full fertility screen to understand your fertility potential, and then medicines can be given. Trust me, people with polycystic ovarian syndrome can give birth. They can conceive. We've had many of them, they can conceive, as long as you've tailored their medication towards the results. Are we together?
We are together, Dr. Thank you so much. And how can somebody contact you, please?
You can go to the website www.druthuman.com and book an appointment.
Thank you.
All right, nice time. Bye. Okay, then we have another question here. Someone is saying, Aisha Nachintu, hello doctor, if someone conceived on 10th September, what's her expected date of delivery? All right, if we are to calculate the expected date of delivery, this is how we do it. Someone conceived and, but I don't know, before I go in for this calculation, because when you say someone conceived on 10th of December, I cannot just trust you like that. You may be talking about 10th of December when it is the day you had sex. And for you to think you conceived on that day, and that is the date you're giving me. We calculate the date you're going to give birth using the LNMP. What is LNMP? LNMP is the first day of the last menstrual cycle. For example, if you had menses today, you started the menses today, that is what we call the LNMP. And like when you conceive, when you confirm that you are pregnant, you look at the day you first had your menses in that last month you menstruated. I don't know if it's very clear. For example, if you test today and you confirm that you are pregnant, this is January, okay? You've confirmed today that you are pregnant. Look at when did you last have your periods? You remember that period. Which day did you start to have that last monthly cycle? The last monthly cycle. The first day of the last menstrual cycle is the day we use to calculate your expected date of delivery. Now, you give me that date. That is the date I want. I don't need the date you think you conceived. Emidong John is saying, please, doctor, one of my girlfriends haven't missed her period before since 3 years of dating of her boyfriend. And she's worried, and she told me that when she was up Karigal, she have taken it before her. Seriously, I'm not understanding your question. Be very clear with this question. Yeah, put some very clear English for me to understand. Doctor knows. Okay. Doreen Tindimwe by saying, hello doctor, if Letrozole is taken on cycle day 3 and the cycle length is 30 days, when can one try a baby girl? What are the chances of conceiving twins? Of course, the chances of conceiving twins, I would say they are a little bit high, around 35%. But for a 30-day cycle, okay, let's calculate for you. For a 30-day cycle, we know that the length, if your length of menstrual cycle is 30 days, we know that your ovulation will be on the 16th day. So if your ovulation will be on the 16th day, chances of having a baby girl will be from, because 16th baby boy, chances are high. 15th baby boy, chances are high. 14th baby boy, chances are high. Now from the 13th day up to the 11th day, 13th day up to the 10th day, those are the days you can have a baby girl. Aisha, I'm off topic. All right, microphone. Okay. Doctor, is it true when you're taking care of a patient with asthma, you can also get it? No, I think this one I will really clear the air. Asthma is not a communicable disease. Okay, asthma cannot be transmitted from one person to the other, except during birth, or except if it's the mother transmitting it to the baby, or the father transmitting it to the baby. It is a genetic disease, okay? It involves genetics, therefore, it cannot be just transmitted anyhow, the way you can transmit your cough, your flu, the way you can transmit your HIV, and so on. Okay, another question. Fufu, hi doc. I have a prefembryo adhesion serapeptase is used, and no, it won't. Fallopian tubes are unblocked physically. Mbambu Evelyn, hi doc, thank you, welcome. Thanks for appreciating. Mutoni Angelique, hi doctor, what causes a baby's heart to stop beating at 8 weeks? The baby's heart can stop beating, that is true, and that is what we call an IUFD. But at 8 weeks, that is an abortion, of course. So it means someone is going to have an abortion. That's all what we call a missed abortion or a missed miscarriage. There are many issues. 1, it can be chromosomal abnormalities. 2, it can be trauma. 3, it can be as a result of blood group rhesus factor incompatibility. There are very many causes of that. Infections, etc., can cause that. Infections like rubella of this world, infections like rubella mainly, and even malaria, by the way, all those ones can cause an abortion. So when you say baby's heart to stop beating, of course you're talking about a miscarriage. Okay, then we have, Nezima Iman is saying, can one conceive after having surgery for cysts in both sides? Yes, you can conceive, as long as the surgery was properly done and the tubes were not tampered with, okay? If tubes were not tampered with, someone can conceive. There is no reason as to why someone should not be able to conceive if the tubes were not tampered with. You can conceive, no problem. You can conceive, and I confirm you can conceive, except if you had any other problem, okay? Except if you had any other problem. For example, you have issues with your hormones and so on, that's when you cannot conceive. Okay, then we have Lydia. My cycle is 28. I had my period on 1st January. When was my ovulation day? All right, so if you have a 28-day cycle, it means 14th day is your ovulation day. Now count 14 days from 26th of December. You'll get to know, from 1st of January, 14 days. Count 14 days, that was your ovulation day. Dija Bubari, how are you and where are you calling from?
I'm fine, sir. Good evening. I'm calling from Italy.
You're calling from Italy. How are the Italianos?
We are fine. We are fine, sir. Please, I can't catch my ovulation date. And I went to the doctors, the gynecologist. They have already made a control for me. They told me that I'm okay, that it's only infection, and they give me some medicine. I use it to wash my body, and everything is okay. Everything is okay because I went back. Everything is okay now, but I can't catch my ovulation day. I don't know. This month, January, I saw my period yesterday. My period started yesterday. So I don't know which day of my ovulation. Please help me, I don't know.
Bubari, what's the length of your menstrual cycle?
But I don't have regular periods.
Yes. Even with irregular periods, you can tell us the length of your menstrual cycle. Have you been watching my videos on YouTube?
Yeah, I have been following you
Good.
more than a year now, I think.
All right. So I guess you've ever watched a video where I was teaching about how to calculate your ovulation day, fertile days in an irregular menstrual cycle. That video is there. So check for it, it's there, but this is how you're going to do it. You are going to count the number of days. You're going to, because if you say that it keeps on changing, it's okay, don't mind about the changes. Just mark the day you've seen your periods and write it. So the day you've seen your periods, in other words, keep on writing the days you see your periods, and then count the number of days in between. Do that for a period of 6 months. So you'll find that you have maybe 26 days, 27 days, 28 days, 30 days, 35 days. Choose the shortest cycle out of the 6 months, all out of the 6 cycles. Choose the shortest. Use the shortest cycle to calculate the length. To calculate your ovulation day and fertile days. I don't know if it is clear. Dija Bobari. Okay.
Let's say I
saw
my period yesterday.
Let me get it for you.
Today is 18.
Dija, don't worry. I'm here for you.
Okay, sir.
I'm here for you. Shouldn't worry. So now, I want you to give me an example. For example, when did you see your periods last year in October?
I saw it 22, October 22.
22nd of October.
Yeah.
Okay. 2023. Do you remember November? Do you remember the one of November? She's off. Sorry.
24. My calendar for my phone. 24.
24th. Okay, that means you can even give me the other month. So let's
24, sometimes on 25.
So now, Dija, let's go slowly. Can you remember the day you had your periods in July last year? I think you're not getting me. I'm going to take you off. Okay. All right, let's answer some other people here. So we have an... please, you see, be with your records very clearly. I have to answer some other people here, but you're on and off.
Okay.
So do you have your calendar there? Do you remember when you saw your periods in July last year?
No, July, I can't remember.
August?
I can't remember. I only remember December. December, yes, but November, no.
Okay, let's go with December. Which day?
24.
24th. of December.
Yeah.
Have you seen your periods in January?
Yeah, yes, yesterday. Yesterday is 17.
17th.
Yeah, yesterday 17, I think.
You think? So
yeah, I saw my period yesterday.
you saw your periods yesterday. So now we are going to count the number of days from 24th to 17th, okay? So we have 24th of December, 25th, 26th, 27th, 28th, 29th, 30th, 31st of December. Okay? 31st of December. So we have 1st January, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th. So you saw your periods yesterday. That is here.
Yeah.
You started your periods on this day. So let's count the number of days. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. So we stop here. So it means that your cycle for this month was 24 days. Are you getting that?
Yes, sir. Yes.
So now, if you want to know, if you have an irregular menstrual cycle, irregular, you have to do this for 6 times. In other words, you've done this, now you know it is 24. You've seen your periods, you saw your periods on 17th. Now do the same when you see your periods in Feb and count the number of days. Now have your list. Okay? Have your list and know that December it was 24 days. January, maybe you'll calculate, let's say 26 days. Feb, maybe you calculate 28. Okay? Feb, then March, maybe you calculate 25. April, you calculate 27. May, you calculate 26 again. Then June, you calculate 28. 1, 2, 3, 4, 5, 6. Now you choose the shortest out of this, and the shortest is 2. No, you go to the website. You go to the website and book an appointment. It's www.druthman.com. You book an appointment there. That's when you can get me.
Okay, sir. God bless you.
Bless you too.
Thank you so much.
All right. Thank you so much. Let's have. Okay, it's back. But haven't conceived. So now, yes, you can go on and do your tests. You can go on and do. But the patterns of your tubes, it is go on and you can also. How are you and where are you calling from? Hold on. I think you take off YouTube. No, you take it off. Wait. Deliver anything. Take off YouTube. Be very loud. You're too low.
Okay, maybe because I'm not using headsets. I don't have headsets at the moment.
Okay? Okay, Priscilla Polima is saying, Doctor, is it true that guava leaves boost fertility? No, it's not true. First of all, you need to know what is contained in these guavas. It's just vitamin C. Okay, it is vitamin C. So if you have a problem, for example, your tubes are blocked, guavas are not going to help you. I have seen people taking okra. Taking okra, and it's so popular, especially with Nigerians, I think, and Ghanaians. Taking okra, thinking that okra will make them conceive and so on. No, if you have a problem, if there is a structural problem, or if there is a problem with your hormones, not be able to conceive even when you take that okra. Okay, then Doctor. Okay, this one I've answered you. Priscilla, okay, I've answered you. I've answered all of you. Please, doctor, I see my period in December 26th. When can I get pregnant? We can tell you when you can get pregnant after confirming to us when the length of your menstrual cycle. Okay. What causes oxanyalala in the body? Please use English for the interest of this channel. We only use the English language. Dr. Salaam Alaikum, how are you there? Thanks for. All right, welcome. Thanks for appreciating. Great job. Uni Lawrence is saying, had mine in 2019. Can I give birth through vaginal birth? Yes. If you had a cesarean section in 2019, right now you can conceive and give birth you can give birth normally. It is okay. It is very okay. What causes lower abdominal pain and body polarization? Lower abdominal pain, I will talk about lower abdominal pain. Lower abdominal pain can be caused by very many things, including PIDs, including cysts, including masses, including fibroids, and so on. All those things can cause lower abdominal pain. By the way, including these infections, the usual infections of the UTIs and so on can cause lower abdominal pain. What causes losing sexual feelings and what is the medicine? Number one, sexual feelings can be lost as a result of aging, okay? When people are aging, sometimes they lose that urge to have sex. That is number one. Number two, it can be a problem with your hormones if you have low levels of estrogen. Estradiol is responsible for providing those feelings, okay? Yeah, so if you have low levels of estrogen, feelings can go down. Feelings can go down if you have low levels of estrogen. And also, by the way, if you have high levels of prolactin, what? Because some people, when they get high levels of prolactin, there will be a negative feedback on the estradiol levels, and therefore, but prolactin will not directly cause a low libido, but instead it will affect the other hormones for you to have that. Now, what is the medicine? Medicine depends on the cause, what is causing that. But of course, in most times, it is as a result of low levels of estrogen, and then after you get estrogen medicines or supplements. There are injections and tablets. Good evening, doctor. Good evening to you. Rabbi Naya Jason. Doctor, I'm confused. I have been taking backup pills for over 2 months, but there is someone told me once. What do you mean? Doctor, I am confused. I have been taking backup pill for over 2 months, but there is someone told me one. Really, I've not understood your question. Be very clear with your questions. Okay, hi, doctor. Okay. Kalulu Finest is saying, I want to know my ovulation date. If you want to know your ovulation date, let us know the length of your menstrual cycle. Biju is for your age, but it is possible.